Oral care saves lives in ventilated patients because the mouth serves as a primary reservoir for pathogens. When a patient is intubated, their natural defense mechanisms are bypassed, allowing bacteria to multiply rapidly. Without intervention, these harmful microbes can easily enter the respiratory system. This simple nursing task is a critical priority for patient safety. Poor oral hygiene increases the risk of ventilator-associated pneumonia by allowing biofilm to accumulate. These contaminated secretions can leak past the endotracheal tube cuff and into the lower lungs. Once inside the lungs, the bacteria trigger an inflammatory response that causes severe infection. Understanding this pathway is essential for preventing long-term complications and extended hospital stays. Provide regular oral care with an antiseptic solution like chlorhexidine according to your hospital protocol. Use subglottic suctioning to remove pooled secretions and ensure the tube cuff remains properly inflated. Consistency in cleaning the oral cavity significantly reduces the bacterial load. A clean mouth is the first line of defense in lowering overall infection risk.